97.1.
Now more Vital Signs with Dr. Randy Tobler. 2007-2008 Best Doctors in America.
Look into mine, Jeepers Creepers, where'd you get those peepers? Jeepers Creepers, where'd you get those eyes? Gosh, all get up, how'd you get so lit up? Gosh,
Oh, listen to that. That's great.
Jeepers
Jeepers Creepers, where'd you get those peepers? Well, that's fitting music to introduce our special guest, Dr. Michael Jones. And I know when I first talked to Dr. Jones, of course, from Illinois Eye Surgeons, I intended to, I set aside 10 minutes, I think, 10, 15 minutes to make introductions, talk. And I think we talked for, I don't know, Michael, what was it, 30, 35 minutes about all the stuff that you guys are doing over at Illinois Eye Surgeons. I mean, I thought I keep up with things, but I mean, you were throwing some technologies out there I was like, I'm clueless about. And so I've had to go back to school. And I know you're involved in education, you're involved in educating your patients, and at Illinois Eye Surgeons, you're proud to be innovators in the field of ophthalmology. So we have a lot to talk about. Thanks for joining us today.
Thanks for having me on, Dr. Tobler. Yeah, I've been known to carry on from time to time, so sorry I kept you on the phone so long.
No, you weren't the one carrying on. I was like sitting at the foot of the master asking questions like, you got to be kidding me. You're already doing this? I thought this was like Star Trek kind of stuff. Dr. Jones graduated cum laude from the St. Louis University School of Medicine. We'll give him a pass on that because, I'm a WashU guy, but that's okay. He's still a good guy. No, and with distinction in research, I should say, and also a member and I'm proud to say I'm a member of this too, the Alpha Omega Alpha Honor Society, and that's a very very nice thing to have in your resume among medical professionals. Joined Illinois Eye Surgeons in 2007, and he was chief resident at the St. Louis University Eye Institute for a year. Boy, just involved in research and teaching and everything. We've been talking about cataract on some of the spots I've been doing for you, Dr. Jones, and you've got a revolutionary cataract surgery that I think you told me is going to be probably the way everyone does it within 5 years, but you're doing it there at Illinois Eye Surgeons. Why don't you tell us a little bit about LensX and exactly what it is?
Yeah, well, first, to understand LensX, you kind of have to understand how cataract surgery got to where it is now. I mean, even the current way of doing it is a very slick procedure, and the patients in the St. Louis area are blessed to have, many good surgeons who do lots and lots of cataract surgery using the newest techniques that you can. But even the standard way of doing it, where we still use a blade to make these tiny incisions into the eye, only takes 5 to 10 minutes usually to get the cataract out. Implanting these lenses, which are now high-definition lenses, giving you full range of vision. The incisions are small enough you don't need a stitch. You don't usually patch the eye afterwards. So even the standard surgery has come a long way in the last 10 or 15 years, and the patients in this area are lucky to have many good doctors that do it. Well, then that begs the question, how can LensX improve on that? Well, what you're doing is you're putting the accuracy of a laser on top of this already advanced technique that we're doing. So what the LensX procedure is using a laser to make the incisions, using a laser to open the cataract up, using a laser to divide the cataract for us, so that all we have to do is remove those pieces and implant the lens. It really makes my job much easier, but it definitely improves accuracy of the procedure. It allows us to better predict where the patient's prescription is going to be. I heard one of your spots talking about trying to predict where that pair of glasses, if even needed at all after surgery, and you hit the nail on the head. It's that predictability that we're looking for. With us doing cataract on younger and younger people, as the baby boomers, their vision needs are a little bit different than the previous generation. They don't tolerate changes in their vision like the older generation. So we're doing surgery on younger people with higher demands of their vision. We have to be able to be predictable with where their prescription is going to end up, and that's the benefit of the LensX procedure.
Dr. Jones, we have Mary on the line who has a question specifically about cataract surgery.
Fantastic.
Mary, welcome to the program with Dr. Jones.
Hi.
Hello.
Can you hear me?
Yes. Hi. Yes.
Okay. My mother. My mother had cataract surgery several years ago, and Monday she's going to have a second surgery because I believe that there's scar tissue that has built up from the cataract surgery.
Yes.
I don't exactly know what this procedure is called.
Okay. That's That's
She's pretty
completely
apprehensive,
normal.
as am I.
Almost every
Can you
single
just
patient
share
gets
with
a
me
lens
the
implant
pros and
of any
cons
type
of this?
at any
What-
time.
What happens is
Wait,
when
hold
Wait a
on.
minute, wait.
Hold
Hang
on.
on.
Okay, go. No, I was Dr. Jones. If you could please repeat that, and Mary, because you guys were both talking at the same time, and I didn't know if you could hear each other. Go ahead, Dr. Jones.
I told you I like to rattle on and on here. I'm sorry.
No, not at all. You're doing great.
Yeah, so, Mary, can you hear me now?
I can hear you, sir.
Yeah, okay. So this is completely normal. I mean, developing that scar tissue on the back surface of that lens implant happens to any person that's going to get a lens implant. At some point, it's going to need this polishing procedure to remove the scar tissue. And the reason is our bodies know that piece of plastic we put in there is foreign. And so eventually it's going to try and attack it and remove it from the body, and you form a scar over it. So using a very simple laser procedure, nothing of the technology we're talking about with LensX, this is a much more simple laser procedure that's been around for decades. Using that laser, we can just blast the scar tissue off the back surface of the lens implant. She'll notice almost an instant recovery in her vision. She may have some floaters as that scar tissue floats towards the back of her eye, but it will settle down in a couple of weeks. But that is a completely normal thing. It happens with anyone that's going to get a cataract surgery and have that lens implanted will eventually need a polishing. So that's completely normal.
What's the timeline? Michael, what's the timeline
You know what?
on
Everyone's
that?
different, Dr. Tobler. I mean, if you're young and healthy and your immune system is, rocking and rolling, you may need that laser procedure to clean the scar tissue off within a few weeks of surgery. If you're elderly and your immune system isn't what it used to be, sometimes it takes years before you need the lens cleaned off. So it's really hard to predict. We just warn the patients initially after surgery, at some point you'll need it. And,
Hang on, Mary. Now go ahead.
Oh, she's 85 and a half. She said when she looks at, there's a wiggly line right down the center of everything that she looks at. So we're talking about the same thing, right?
Without seeing her, it's hard to say. If her doctor looked in and saw that, it's not, when you see that scar tissue, you can't miss it. So, I mean, if her doctor looked at her under the microscope and he says the lens implant is cloudy, it's really a no-brainer to go in there and laser it. I hope that takes care of the wiggle in her vision. If not, we need to make sure we look very closely at her retina and make sure that there's nothing going on there.
Okay.
At being 85, one thing you'd want to be concerned about is early macular degeneration.
Mm-hmm.
So the first thing we do is clean the scar off, and then we bring her back in a couple of weeks and make sure that her retina is healthy.
Okay.
Thank you, Mary.
Thank you so much. I
Thanks,
appreciate
Mary.
your time.
Doctor, if you're just joining us on Vital Signs, we are speaking with Dr. Michael Jones, and he is from Illinois Eye Surgeons. He is one of the best of the best. Your questions about your Jeepers, Creepers, Peepers at 969-9797, 866-455-9797. Dr. Jones, what is the most popular procedure done at Illinois Eye right now?
Well, just like it is everywhere in the country, cataract surgery is the most commonly performed ophthalmic surgery. In fact, it's one of the most common procedures performed in the U.S., period, and that's because of the aging population. There's over 1.5 million cataract surgeries done in the U.S. last year, only a small percentage of them at Illinois Eye Surgeons, although sometimes it seems like them all. But it's the most common procedure that we perform. Now, a close second would be LASIK. When we're dealing with younger patients, but by far and away it's cataract surgery because of the aging population that we have.
Can younger people benefit, excuse me, let me get that backwards. Can older folks benefit from LASIK as well as younger population?
No, not really.
Okay.
That's the reason that LensX was needed. What we needed to do was be able to provide the accuracy of LASIK when doing cataract-type procedures because, like I was mentioning, our quote-unquote elderly population now is very active, and they need to make sure that that they can function without glasses. And so the LensX brings that LASIK laser predictability and accuracy to a procedure like cataract surgery, where we didn't have it before. The problem with doing LASIK on someone in that age group, in the older age group, is if their cataract has not yet been removed, if I put that prescription on the surface of their eye with LASIK, as their cataract grows, their prescription may continue to change. It means that investment they just made in LASIK won't pay off. Now, doing a LensX procedure with a lens implant with cataract surgery, that's a much more permanent fix for your vision.
All right. Hey, we've got just a ton more we want to talk about. If you can hang with us for another segment, Dr. Michael Jones, we sure appreciate it. And we'd invite your calls, folks. 969-9797, 866-455-9797. We're talking with Dr. Michael Jones.